So the first speaker is Andrea Brown, our Chief Executive. Now, Andrea's been with the charity for 9 years, and in this time worked in the helpline, been the office manager, and now Chief Executive. And as you're going to hear, the charity is in an excellent position, helping more patients than ever before.
Good morning, everyone. Thank you for joining us today for the virtual patients event. This is the first time we have held the event in this format, and it will hopefully be the last. We know how much everyone enjoys the face-to-face events, as it gives us time to speak with old and new friends. We enjoy chatting in the exhibition rooms, over lunch and in the corridors. The social interaction is what we all miss. So we hope we can see you all next year in the flesh. Here is a brief outline of some of the work the NKF has been doing this year. So the first thing I need to start talking about is something we never knew about 2 years ago, COVID-19. This horrible disease came bursting into all of our lives and completely changed the way of the world, the way we live, the way we greet people, the way we interact in our daily lives. It really has impacted us all. Our patients have had the most horrendous time over the last 18 months. They have not been given timely advice from the NHS. GP's appointments have become non-existent face-to-face. And well, if you need a dentist, you may as well say goodbye to your teeth. We've gone in and out of lockdowns, have shielded, paused shielding and ended shielding. We have had first vaccines, second vaccines, and have gone through uncertainties of third vaccine doses and boosters. Are we eligible? When will we have one? Is the end in sight? I don't think so. It's here to stay for now. At the start of the pandemic, we joined the COVID-19 Renal Guidance Group, which was headed by the Renal Association, now known as the UK Kidney Association, and chaired by Paul Cockwell. This was a very large group of renal professionals and kidney charities working together to make lives for patients as good as possible during the pandemic. This group had subgroups, which the NKF was involved in, one being KQIP, ensuring hemodialysis patient safety, chaired by Rosie Don. This group provided information, guidance and joint statements for renal professionals and patients. We have provided lots of up-to-date information on our website throughout the pandemic and have also signposted from there to other useful resources to support patients. At the start of the pandemic, the helpline received hundreds of calls weekly from very worried patients and carers, and they have guided and advised them through the pandemic. We designed, produced and sold 17,000 social distancing lanyards and 6,000 face masks to help patients feel safe when they are out and about. We are still selling both. There has been another high demand for the NKF face masks, as many are saying they are the most comfortable masks they have worn. During 2020, the NKF asked stakeholders and KPAs to do an analysis of the NKF and feedback what we could put into our new 5-year strategy. The executive committee and staff got together to devise and produce a 5-year strategy. The strategy is ambitious, but this is what will guide the charity through the next 5 years to ensure it is meeting the needs of our kidney community. The vision is a better future for those affected by kidney disease and their families. The mission is to improve the quality of life of kidney patients and their families across the UK. And the values are: together we are stronger, responsive, supportive and inclusive. From the strategy, we produced a development plan for 2021 and we will update this yearly. The development plan has input from the executive committee and the full staff team, setting the priorities for the year ahead. The plan is monitored regularly by the staff team and the executive committee, ensuring we meet targets. We produced, published and sent out our very first impact report, updating everyone on what had been achieved by the NKF in 2020. Impact reports will now be produced yearly. It is important that we update our stakeholders and supporters with what we have achieved. We have increased our staff team now and have a team of 9. We will have 11 when our 2 vacancies are filled. This is the most staff the NKF has had in years. This year we have been lucky to have had more executive committee members join our board than what we have had in previous years. The time and dedication they give to the charity as volunteers is to be commended, and I thank them for their help and support. We have strengthened our networks considerably in the last year. At the beginning of the year, we renamed and redesigned our patient information leaflets, now called Kidney Issues, and sent samples of them along with a newly designed patient support pack to over 300 renal units and to all KPAs. They have been well received and lots of orders have been received, printed, packed and posted. During the pandemic, KPAs were struggling to hold meetings due to not being able to meet face-to-face. We enabled them to hold meetings using our Zoom account, and it is now used by many KPAs to facilitate their meetings. We also identified KPA ambassadors. Ambassadors are there to provide help and information to other KPAs who may require a little help and support. We are about to get this off the ground. NKF was invited to join the Renal Services Transformation Programme by NHS England, known as RSTP. We have different NKF reps on all of the 5 work streams, which are dialysis, transplantation, acute kidney injury, systems working, and chronic kidney disease. I am the NKF rep for the RSTP programme board. The aim of the programme is to support the transformation of renal services through commissioning to improve the quality of care and outcomes for patients, in particular to support renal services in their recovery of elective activity following the pandemic and to benefit from more integrated commission of services within local systems. NKF will ensure the patient voice is heard throughout the life of this programme. The All-Party Parliamentary Group has now all of its officers and is awaiting its AGM. The group will hold regular meetings to highlight the most relevant renal issues. We will continue our collaborative work with the UK Kidney Association, NHS England, NHS Blood and Transplant and the other kidney charities. We have collaborated with Kidney Research UK to help fund a COVID-19 vaccine research study for hemodialysis patients, along with several KPAs. Researchers from Imperial College London and the Francis Crick Institute are investigating how well the COVID-19 vaccines provide immunity to COVID-19 infection. Blood samples from more than 1,200 hemodialysis patients across the UK are being studied before and after each dose of vaccine. Data from the first 180 patients was accepted for publication in the Lancet. This shows that in patients who have not been previously infected with the COVID-19 virus, those who have received the Pfizer vaccine have 6 times higher level of neutralizing antibodies against the more contagious Delta variant compared with people who received the AstraZeneca vaccine. The researchers said the level of neutralizing antibody to Delta made by hemodialysis patients who have not had prior COVID-19 infection and received the AstraZeneca vaccine might not be enough to prevent infection with Delta. Importantly, we have found that this group without prior infection responds well to mRNA vaccines such as the Pfizer vaccine, and we can use this information to inform future vaccination strategies. Knowing the way in which patients respond to different vaccines is crucial to ensuring the best outcomes are obtained for the kidney community. The evidence provided by the study is so far helping to inform scientists and clinicians with the decisions about future vaccinations. At the end of October, researchers will report on the 6-month findings of the study, highlighting any emerging trends. The NKF is also working closer with renal paediatric services and professionals, seeing where we can provide help and support. We have increased our national profile by interacting with our community on social media networks, our website, our newsletter, and our quarterly magazine, Kidney Life. Social media followers are increasing all of the time. We currently have over 5,000 followers on Twitter. Facebook has nearly 6,000 followers, and Instagram is something we haven't been using for long, but followers are increasing. The traffic to the website has always been good. In a 9-month period, we have had 500,000 sessions, which was a large increase to previous months. Our monthly newsletter, In Touch, is emailed to over 8,000 supporters. Kidney Life, our quarterly magazine, is printed and posted out, as well as sent electronically to over 20,000 supporters. At the beginning of 2021, we launched a national campaign to increase home dialysis in the context of COVID-19. The campaign followed a webinar we hosted in September 2020, which resulted in a report with 7 recommendations. One of the recommendations was to request clinical directors of renal services to develop a plan of action to reach a minimum prevalence rate of 20% of patients receiving home dialysis by 2024. This plan is to include staffing levels, training needs, support and training for patients, a review of shared decision making, address the barriers of home dialysis faced by BAME patients, and to work with local KPAs to develop the plan. On the 1st of September this year, the NKF launched a home dialysis peer support service. We have over 20 wonderful volunteers who are fully trained to speak with people who are wanting or thinking about dialysing at home. This has gained fantastic momentum in the last month and has had some great support from patients and clinicians. This is the first national home dialysis peer support service in the UK. Please do get in touch if you require any further information on this service. Over the next couple of months, we'll be undertaking a survey of dialysis patients to find out about the barriers of home dialysis in the context of COVID-19. We are doing this in conjunction with the University of Hertfordshire and will publish the findings in the new year. We are also encouraging KPAs to raise home dialysis with their clinical directors. We will publish an updated report on the campaign in early 2022. This will include centre-by-centre data with the support of the UK Renal Registry. NKF Helpline is the most valued service for patients, carers and healthcare professionals. We have had increasing calls and we are developing the service. We have increased the staffing hours and will continue to do this to meet the needs and demand of the service. Helpline are also managing the peer support service through every stage. During the first 9 months of this year, the Helpline have helped, supported and guided over 4,500 callers. The top caller topics are COVID-19, CKD, medical advice and dialysis. The Helpline manages a huge leaflet library. They process all of the orders received by patients and renal units. All of this is done in-house, from printing to folding to packing and posting. And we are fortunate to have the help and support of Mr. Jeremy Crane, who reviews our medical leaflets to ensure they are up to date with the latest guidance. Fundraising is going from strength to strength. This year we introduced a new challenge called Best Foot Forward. This has been the challenge that has made the most impact and income for the NKF to date. We continue to do our other challenges, the Water Challenge and Choctober, both of which have lots of participants. Our marketing team work with the Kidney Charities Together Communications Group, where the kidney charities work together on joint COVID communications and yearly events such as World Kidney Day. It is great to see the charities working together to ensure the messaging to patients is uniform. We have this year introduced 3 new roles to ensure we are communicating and marketing the charity to our supporters in the best way possible. Here are some of the key things the NKF will be doing in 2022. We'll be holding patient-focused webinars. We'll be working closely with KPAs to identify any help and support they may need. We will continue to develop the National Peer Support Service with the NKF Helpline. We will provide an update on the home dialysis campaign and work with providers and clinicians to see how we can integrate this in advanced kidney care pathways. We will develop useful patient blogs and videos on our website. We will work with the Renal Services Transformation Programme to ensure the patient voice is represented at all levels and monitor the new integrated care services and the impact this has on specialised services. We will continue to work with the NHS Blood and Transplant with regard to donation, transplantation and organ utilisation. We will continue to work with our professional and patient colleagues to ensure we support patients throughout the year. I would like to thank all of our supporters, professional and patient colleagues and our industry partners for their support of the NKF. Lastly, but by no means least, I would like to thank my staff team for all of their dedication and hard work to ensure the vision, mission and values of the NKF are being met. Thank you for listening. I hope you enjoy all of the wonderful speakers we have lined up for you today.
Andrea, thank you very much. And as you can hear, what a busy charity we are at the moment.